Hello, it's Dr. Rachel Brown, Medical Director of Prevention and Wellness in Business Health Solutions at Prisma Health, and this is your monthly health and well-being update. Of course, everyone has lots of questions right now about the bivalent COVID booster, so we're going to jump right in and start talking about that. Let me share my screen with you, and let's just start with a little bit of an update on where we are in terms of COVID infections. If you take a look at the DHEC site, and again, you have the opportunity to select your date range here and look at different counties' measurements. But if we look at the last 2 months, things have been pretty stable, okay? COVID is definitely out there. You've probably had lots of employees, lots of friends, lots of family members have COVID. It's still disruptive, but the good news is we're not seeing a big surge at this current time. However, respiratory illness season is right around the corner. And one of the best ways to manage any respiratory illness is through available vaccines. So let's get to talking about this new COVID booster shot. The original shot was something called a monovalent shot or vaccine, and it meant that it was protective against a particular strain of the COVID virus, the original strain. What they have developed is a bivalent or updated COVID booster. And not only is it protective against the original strain of COVID, but it's specifically protective against the Omicron BA4 and BA5 variants. And that is primarily what we're seeing in the community right now. So think of this in the same way as we think of flu shots. So each season, we try to get the best ideas around what variant of the flu virus is circulating and build a vaccine that's going to target those particular variants. Sometimes it works really well, sometimes it just works okay, but that's the goal here with the COVID booster as well. Now, here are the guidelines around who can get that new bivalent COVID booster. Anyone over the age of 12 is strongly encouraged to get this booster. If you are under the age of 18 and over the age of 12, you have the Pfizer vaccine available to you. However, everyone over the age of 18 can get the Pfizer or the Moderna bivalent booster. Now, when can you get these booster vaccines? At least 2 months after any previous booster you may have received. Or if you have never received a booster 5 months after your primary vaccine series, if you've never received a vaccine at all for COVID, you have to start from the beginning and get your primary vaccine series of the Moderna, of the Novavax, of the Pfizer, or of the J&J. There are wonderful charts and informations to tell you who can get what vaccine when. If you scroll down, you can pick the vendor and age and whether or not you've had the primary series versus whether or not you've had a booster. But the bottom line here to realize is that everyone over the age of 12 is encouraged to get this new bivalent booster in anticipation of respiratory illness season in the fall. That needs to happen 2 months after any previous booster. Now, people will ask me what happens if I've had COVID. If you've had COVID, you only have to wait until you're symptom-free to get that COVID booster, the new COVID booster, only because it may make you feel worse. There's no clinical indication for waiting. However, you do have an option if you've had COVID and want to wait 3 months to do that because it's felt that you have pretty darn good immunity just from that infection, okay? So to recap, 2 months after your last booster, 5 months after the primary vaccine series, and then 3 months after you've had a COVID infection, if you would like to wait. Otherwise, if you've had a COVID infection, just wait till you feel a little better and then get that booster vaccine. Now, this was approved on September 1st, so this is all very new. The FDA authorized the bivalent booster, and then the CDC followed up with sponsoring recommendations. We are seeing the booster available in our CVS's and in our Walgreens already. It's unclear what the supply chain will look like. So if you're finding that appointments are filling up, that may not be a surprise. Other healthcare systems and practices around the state will be receiving their supply of the bivalent vaccine from DHEC very, very shortly. So we should see a lot of opportunities to get these vaccines. Now, there is a push in the vaccine campaign to talk about getting the flu vaccine and the COVID vaccine together. And part of the reason for that is because our booster numbers are still, or excuse me, our vaccine numbers in South Carolina are still pretty low. You can see here all eligible residents, and that includes all children under the age of 5 older than 6 months. We really have just over half of our residents who are fully vaccinated. If we remove the younger population, it's close to 60%, but still not the percentage of the population that we need for these vaccines to do what they need to do, and that is to really protect us all. And so encouraging folks to get, if they're going to get their flu vaccine, to go ahead and get their COVID booster makes sense, right? It's efficient. You can do that. There's no clinical indication that you can't have those vaccines at the same time. And most people don't feel worse when they get those vaccines together. We know that there can be some post-vaccine symptoms. Sometimes it feels like you actually have the flu a little bit or COVID, but it's just our immune system's reacting to that vaccine and doing exactly what they're supposed to do. There's no evidence that doing them together makes those symptoms worse. Now, I will throw out one caveat, and you may get this question, and you may have this question yourself. If we encourage folks to go and get their COVID bivalent booster as soon as possible and get their flu vaccine at the same time, that might be a tiny bit early for flu. It's probably okay. It's not a problem if you get both of these in September. However, if flu peaks later in the season, say around that March time of 2023, your immunity from that flu vaccine in September may be starting to wane. So in general, we recommend that you get the flu vaccine sometime around the end of October, maybe even into early November, just so you have full protection for the entire season, unless we see numbers start to spike earlier than that. So folks will kind of play a game and decide when the best time is to get their flu vaccine. So maybe you're eager to get your COVID booster now, and you're going to wait and get your flu vaccine later. Probably okay. Maybe you've decided, you know what, I just want to get them both right away. Also probably okay. So lots of variations there, lots of ways to approach it, and it really is just what's comfortable for you and your employees. Now, if we start to see numbers of COVID or numbers of flu spike, then you're going to want to go ahead and get those boosters and vaccines right away. Keep in mind that Business Health does do vaccine clinics, both COVID and flu vaccine clinics. So please enlist us if this is something you'd like to do on your site for your employees. This is a great time to see if we can get this number to go up. And it's a great time to see if we can get as many people as possible protected from the flu virus. Remember that vaccine campaigns are meant to do two major things: get as many people protected as possible so that there's not as much transmission of these viruses. And so the season ends up being very, very slow. The other is to protect folks from severe consequences and hospitalizations. So yes, you're still going to see some COVID infections. You're still going to see flu in folks who've been vaccinated, but the goal is to have as much herd immunity as possible and to prevent those consequences. So it's time to talk to your employees again about these vaccines. We know things have died down a little bit. There's not as much hubbub around it, but it's just as important. And lastly, you may have heard that the White House has released a statement that they're really looking at this as kind of an annual respiratory season vaccine campaign around COVID and COVID boosters, just like the flu. That is with the cautionary caveat that if we see a new variant or we see aspects of the COVID pandemic that change, certainly we would not be waiting until next fall to do this again. Okay, so good time to talk to folks about vaccines again. Happy to come and do that for your leaders, for your employees, and we're happy to set up vaccine clinics. So let's talk a little bit about flu and the difference between flu and colds and allergies and COVID, because this is what the question is for all of you, right? When someone says they have symptoms, when do we have them tested? When someone tells you, oh, it's just allergies, when do we worry about that? There's a chart here from the National Institute of Health, specifically their National Institute of Aging section, that can break this down for us a little bit. Of course, this is not always going to be the case, but you can see folks tend to be sicker with the flu and COVID. They're going to have fever. They're going to have those body aches. They're going to feel very, very tired. Whereas colds have the typical cold symptoms: congestion, runny nose, sneezing, cough. Again, the flu and COVID viruses cause more trouble with breathing. They may cause vomiting and diarrhea, but look how closely flu resembles COVID-19. Right? It's often very difficult, even for those of us who see this and our clinicians, to tell the difference between these two. So let's get tested, right? Encourage your employees to get tested for flu and COVID so that we know what they need to do in terms of isolation and masking and so forth. And just so we know who needs to be taken care of how and who's at higher risk. All right, I just want to very, very briefly review the screening and quarantine recommendations because they have changed a little bit since the last time we talked. Folks who have documented COVID infections should certainly isolate. We know that. Sorry, I'm trying to get to my screen here. We know that they should isolate. They should isolate for 5 days, and they should wear a mask for an additional 5 days if they're feeling better, but their symptoms are improving and they're ready to come out of isolation. This very neat isolation and exposure calendar can be very, very helpful to you in knowing what to do with your employees if you're concerned. So if they tested positive or they have symptoms, regardless of vaccination status, it's going to require an isolation if they're positive. So let's say they have symptoms. You tell them when your positive test was, let's say it was yesterday, or when their symptoms started, excuse me, and then we'll continue to ask questions, eventually leading the person to either getting a test or isolating at that point if the test is negative. Now, if we are, positive, if we're exposed to COVID, here's where the big difference is. If you march through this calculator, or this chat box, I've been exposed. Let's say I came in contact with someone. I've not had recent COVID infection. That actually does protect me. But let's say I haven't had a recent COVID infection in the last 3 months. And I found out this person was positive. I was exposed to them 2 days ago. It's going to tell me, regardless of my vaccination status, really regardless of anything, that I need to mask. But what you'll notice here that's very different from before is there's no longer any quarantine rules. So we isolate folks who are positive for 5 days. They can come out of that isolation if they're feeling better, but they need to mask for an additional 5 days. But we're not quarantining anyone. We may ask someone who's waiting for a test result to kind of stay away from everyone until they know that that test result is negative and then isolate if it's positive. But if someone's had a close contact, we're really just asking them to mask and be mindful of who they come in contact with. Now it will recommend getting tested at day 5, and here you can see the chat box will tell me exactly when that day is that I need to test. And of course, if that's negative, I can feel pretty good that I don't have COVID. I may be a little more careful around folks who are at high risk. If it's positive, I begin isolation. Okay, so no more quarantining for exposed folks. For now, right? Things could change for sure. All right, the last thing I want to say about COVID is that, again, please encourage employees to get tested. Allow for policies and processes that make that easy for them to do. We want to know, do they have flu versus do they have COVID? The other important reason for that is that if you are able to diagnose someone with COVID sooner than later, you can get them on medications to help with those symptoms, to help with keeping their transmission low, and to help with preventing long COVID. And those medications like Paxlovid need to be administered within the first, say, 3 to 5 days of that infection. So we really need folks to feel comfortable with testing instead of saying, oh, this is probably just a cold. Flu is the same way. There are medications that can be helpful in shortening the duration of flu symptoms, only if they're given within the first 48 hours. So please encourage your team members and your employees to get tested. Now we're going to move on to our well-being topic of the day. Now you will be watching this video after September 9th, but I will mention that September 10th is World Suicide Prevention Day. And this year, this is more important than ever. The data is showing that in general, most folks are feeling some increased level of stress, and that may be just an increased level of anxiety and feeling of pressure or worry, all the way to folks who are really suffering from PTSD symptoms, depression, anxiety, severe anxiety, and who may be contemplating suicide. And so we need to be tending to our workforce. We need to be watching and making sure these folks are feeling healthy emotionally. The only way most employees are going to engage with any EAP or other support resources you have around mental well-being in your workplace is if they feel psychologically safe. And that's a culture within a workforce, right? They need to feel that their leaders support them, that the organization supports them in pursuing whatever they need for their mental health. And they need to feel like, as a community, as a workforce, it's okay to talk about feeling overwhelmed or stressed or very depressed or even scared that you may hurt yourself. So in order to start that process, if you feel like you have a culture within your workforce that may not feel psychologically safe about talking about these things, leaders must talk about them. So whether that's directly from executive leadership, from supervisors and management level, talking about this being a real issue across our nation and likely across our globe is the best way for folks to begin to feel comfortable with the idea that it may be okay to talk about this. We encourage leaders to do wellness rounds or one-on-one rounding where you specifically ask each one of your team members or employees, how are you doing? How are you feeling? How do you feel like your stress level is? How do you feel like you're emotionally coping with what's going on in the world and with healing from the last 2 years? That can be a scary thing to do as a leader because you're not quite sure what to do with the answers sometimes. So we do have programs in place that can help train you to do psychological first aid, how to do wellness rounding. We have tip sheets on how to, what kinds of questions to ask, how to be a great listener, and how to point folks to the right resources and navigate them into what they need. You could do this on a larger scale too. Often tips around coping with stress or lunch and learns around building resilience can be helpful in terms of giving practical information to your employees, but also just setting the tone for your workplace that this is important to us. We understand things are difficult, and here's what we're doing to try to tend to it. Even if folks may feel shy and not share, they're getting the message from you that this is important. And we provide those things as well: resilience workshops and sessions, resilience curriculums, stress coping techniques. Whether you want that in an hour-long webinar or snippets throughout the month and year, we can do that for you. And finally, sometimes all a person needs and all a workforce or a team needs is a little bit of fun. The weather's going to get cooler. We need to get back outdoors. It's good for us. Sunshine is good for us. Fresh air is good for us. Physical activity is good for us. And so there may be ways for your workplace to encourage not only folks getting outside, especially if you're a workforce where folks are generally inside, and especially if you're a workforce where folks are generally sitting at their computers. Let's get folks outside enjoying that fresh air and sunshine, and let's make it fun. You can come up with walking challenges and have teams have friendly competitions with each other. Encourage hobby groups or sports intramural teams within your workplace. It might be fun to have a faux tailgating party out in the parking lot and ask folks to bring their favorite tailgating foods and maybe put a healthy spin on it and put together a healthy recipe book for your workforce. Get folks outside by setting up walking paths or quiet spaces outside. Maybe it's not counseling they need. Maybe they just need a break, or they need a brisk walk in that fresh air and in that sunshine to really kind of get their emotional well-being under control. So let's think about that. We're coming out of a fog. A lot of people are going to feel relief, but we are seeing data to suggest that most of us are having some symptoms of mild PTSD from this last, at least mild PTSD from this last go round. So let's tend to that. We'd love to help you any way we can. So as always, please reach out to us by clicking on our Creating a Safer and Healthier Workplace page. Scroll down a little bit here. You're going to see the number where you can reach out to us. You can have a consultation with me. We can talk about what you may need for your workforce, education-wise, vaccine clinic-wise. We have nutrition and health counselors that can join that tailgating party and help people come up with healthy versions of their recipes. Whatever it is you need, we're here to care for you all so you can care for your workforce. And I will see you again in a couple of months. Take care.